All right, everyone, get ready for a deep dive. We're tackling adrenal gland tumors today.
Adrenal gland tumors.
Yeah, I know it might not sound like the most exciting topic,
Hmm.
but stick with us because it gets really interesting.
Yeah.
We've got a whole stack of research here,
Oh, wow.
and we'll be using UpToDate as our main source, especially an article about how these adrenal tumors present themselves and how doctors evaluate them.
Okay.
So by the end of this deep dive,
Okay.
you'll be able to decode what doctors are saying,
Yeah.
ask them the right questions,
That's a good skill.
and maybe even,
Yeah.
impress your friends with some adrenal gland trivia.
People are going to be so surprised by how often adrenal tumors actually show up.
Really?
Yeah. And how many people are walking around with them and don't even know it.
Wow. So they're more common than we think.
Oh, yeah, for sure. Let's start with the most common type, benign adenomas.
Okay.
These often just hide out in the adrenal glands, quietly doing their thing,
Mm.
until they're accidentally found on a scan for something totally different.
Oh, interesting.
Yeah, we call those incidentalomas.
Incidentalomas,
Basically, surprise findings on your medical imaging.
like a surprise guest?
Exactly. And studies actually show over 4% of high-resolution abdominal scans find these incidentalomas.
Wow. So it's like going in for a checkup and bam, you've got this extra thing you didn't know about.
Yeah, and while most of them are harmless,
Hmm.
up to 15% can actually be functional, meaning they're secreting hormones that can cause problems.
Okay, so not all incidentalomas are created equal.
Right.
Some of them are troublemakers.
Exactly. A common example is subclinical Cushing's syndrome.
Subclinical Cushing's.
Yeah, imagine having slightly high levels of cortisol, but without the obvious symptoms you typically see with Cushing's.
So you might not even realize anything's wrong.
Yeah, you might not notice, but those extra hormones can have long-term effects.
So even if you feel fine, it's worth getting checked out.
Yeah, screening for hormonal issues is important, even when those adenomas seem to be behaving themselves.
Okay. But how do these adenomas actually work? Like what makes them start pumping out those hormones?
Well, the traditional view was that they just acted on their own, like
Mhm.
rogue cells going off script.
Yeah.
But we've learned it's more complex than that.
Okay.
Many adenomas are actually driven by what we call aberrant receptors.
Aberrant receptors.
Yeah, think of it like the adenoma is responding to the wrong signals.
So it's a case of mistaken identity at the cellular level.
Exactly. For example, a cortisol-secreting adenoma might be reacting to signals that are actually meant for other hormones, like vasopressin or serotonin.
Wow. What about other types of adenomas? Do they have their own quirks?
Oh, absolutely. Aldosteronomas, for instance, these are adenomas that produce aldosterone,
Okay.
a hormone that regulates blood pressure.
Right.
And some of these develop because of a tiny glitch in a potassium channel gene.
A gene glitch.
Yeah, it messes up the balance inside the cells and leads to too much aldosterone.
So even a tiny error can have a big impact.
Yeah. But we've been talking about how doctors figure out if an adenoma is benign or something more serious, and you mentioned size matters.
Yeah, you said that before.
Well, size is a big clue.
Yeah.
Most adenomas are under 4 centimeters.
Okay.
But carcinomas, the malignant type, are usually bigger when we find them.
Got it. So bigger is not better in this case.
No, not really. It's kind of like comparing a ripe avocado to an unripe one.
You can tell just by the feel.
Exactly.
Okay. But what if it's right on that borderline? How do doctors know for sure?
Well, that's where imaging comes in.
Oh, okay.
CT scans can measure how dense the tumor is. Adenomas tend to be low density, like fat, while carcinomas are denser.
Okay, so that helps differentiate.
Yeah, and if there's still doubt, MRIs can give us a closer look to see if the tumor is invading surrounding tissues, which is a classic sign of a malignant tumor.
So it's like gathering clues to solve a medical mystery.
Exactly.
Yeah.
And while adenomas are the most common, we can't forget about their rarer but more serious cousin, adrenocortical carcinoma.
Adrenocortical carcinoma.
Or ACC for short.
Okay.
ACC. Now, it only affects 1 or 2 people per million each year,
Hmm.
but it's still important to understand.
Definitely. So ACC can also be functional or non-functional.
Yeah, just like adenomas, but the
Yeah.
way they show up can be quite different.
Interesting.
Adults with functional ACCs often have Cushing's syndrome.
Cushing's again?
Yeah, or a combination of Cushing's and virilization.
Virilization, that's the development
Yeah.
of male characteristics in women, right?
Exactly, because of too much androgen production.
Okay, so some pretty significant hormonal imbalances there.
Yeah. And in children with ACC, virilization is actually the most common presentation,
Hmm.
while Cushing's syndrome by itself is less frequent.
So the presentation varies depending on age.
Right, because of the different hormonal profiles at different stages of life.
That makes sense. But how do you actually diagnose ACC? What steps do doctors take?
It starts with a good medical history and a physical exam,
Okay.
looking for signs of any hormonal imbalances.
Right.
Then we move to blood and urine tests to measure those hormone levels.
Hmm.
Even if someone seems healthy,
Okay.
they could still have underlying issues, so these tests are really important.
Right, because we learned that subclinical Cushing's can fly under the radar.
Exactly. And here's something fascinating. ACCs, while they might not be great at producing the final steroid hormones,
Okay.
they tend to overproduce the precursor molecules.
So like having the ingredients but not being able to bake the cake.
Well, perfect analogy. And that overabundance of precursors can be a warning sign.
I see. So along with blood and urine tests, imaging is also crucial.
Definitely. CT and MRI help us visualize the tumor,
Okay.
see its size, location, and look for features that distinguish it from a benign adenoma.
And I guess those FDG-PE scans we talked about earlier come in handy here too.
Oh, for sure. They highlight areas of high metabolic activity,
Right.
which is typical of cancer cells.
Mm.
And that helps us differentiate between ACCs and benign adenomas, especially when other imaging isn't clear.
So it's another piece of the puzzle.
Right. And sometimes a fine needle aspiration biopsy might be needed.
Okay. A biopsy, that sounds a bit more invasive.
Yeah, it's a way to get a small sample of cells from the tumor to examine under a microscope.
I see.
Helps rule out metastatic tumors.
Meaning cancers that have spread from somewhere else.
Exactly.
Mm.
It's crucial to determine if the adrenal tumor is the primary problem or a consequence of cancer elsewhere.
Makes sense. So we've got medical history, physical exam, blood and urine tests, imaging, and potentially a biopsy. It's quite the process.
It is. It's like detective work.
But once an ACC diagnosis is made, how do doctors figure out how serious it is?
Yeah.
That's where staging comes in, right?
You got it. The TNM staging system is a way to categorize ACC based on the tumor size,
Okay.
whether it's spread to lymph nodes,
Right.
and if it's metastasized to other organs.
So it's a code that tells doctors how far the cancer has progressed.
Precisely. And it's important to remember that there are different staging systems.
Oh.
Yeah, and the field is always evolving.
Okay.
The ENSAT staging system, developed by the European Network for the Study of Adrenal Tumors.
Oh.
It's considered an improvement over TNM. It focuses more on the presence of distant metastases, which is a key factor for a patient's prognosis.
So they've fine-tuned the system.
Exactly. And for children,
Yeah.
there's a separate staging system that's a bit simpler.
Okay.
It mostly focuses on tumor size and whether it's been completely removed with surgery.
Got it. So TNM, ENSAT, and a system for children. Seems like a lot to keep track of.
It is. But the main point is that staging helps doctors tailor the treatment plan.
And even though we've been discussing these complex systems and maybe some scary diagnoses,
Yeah,
remember that knowledge is power, right?
absolutely. Understanding these concepts can really help you advocate for yourself or your loved ones.
So true. But let's bring it back to our listeners.
Okay.
What does all this info about adrenal tumors actually mean for them?
Well, if you take away one thing from this part of our deep dive, let it be this. Don't ignore incidental findings on your scans.
So if your doctor mentions an adrenal mass,
Yeah, ask about it. Get screened for hormonal issues.
because even those quiet incidentalomas could be causing trouble.
Exactly. Pay attention to your body. If you notice sudden changes like in your weight or energy levels or any other unusual symptoms, don't hesitate to talk to your doctor.
Right. Early detection is key.
It really is. And never be afraid to seek a second opinion or consult with a specialist if you have any concerns.
Great advice.
You deserve to feel confident and informed about your health.
That's so important. Well, that wraps up part 1 of our adrenal tumor deep dive. We've covered a lot, from the different types and how they're diagnosed to this whole concept of staging.
Yeah, lots of information.
But there's still more to explore. Join us next time as we dive deeper into the world of hormone-secreting adrenal tumors.
It's going to be fascinating. We'll see you then.
See you next time. Welcome back to our adrenal adventure. Last time we were talking about those hormone-secreting tumors.
Ah, yes. The hormone factory's gone rogue.
Right. So let's dive into what happens when these little glands start overproducing those hormones.
Well, it really depends on which hormone is being overproduced.
Okay.
One of the common culprits is cortisol.
Cortisol, the stress hormone.
Exactly. And when you have an adrenal tumor churning out too much cortisol, you can get Cushing's syndrome.
Cushing's syndrome, we touched on it before.
Right.
But let's unpack it a bit more. What are some signs that someone's cortisol levels might be out of whack?
Well, one of the most noticeable signs is weight gain.
Okay.
But it's not just any weight gain. It tends to be around the abdomen, face, and upper back.
So it's about where you gain the weight, not just how much.
Exactly. That's because cortisol plays a role in how our bodies distribute fat.
I see.
And along with the weight gain, people with Cushing's often develop these very distinct features.
Like what?
A rounded face, sometimes called a moon face, and a fatty hump on the back of the neck, sometimes called a buffalo hump.
Oh, wow. Those would definitely be noticeable.
Yeah, and unfortunately, those physical changes are just the beginning.
Oh, no. What else?
Cushing's can also lead to muscle weakness, thinning of the skin, easy bruising, and slower wound healing.
Wow, that's a lot.
Yeah. And it's all because of how cortisol affects protein metabolism.
It's amazing how much power these hormones have.
Absolutely. But Cushing's isn't the only hormonal imbalance we see with adrenal tumors.
Right, there's aldosterone too.
You got it.
Yeah.
Aldosterone is crucial for regulating blood pressure
Right.
and electrolyte balance, things like potassium.
Okay.
And when an adrenal tumor overproduces aldosterone, it can lead to primary aldosteronism, also known as Conn syndrome.
Conn syndrome, all right. Another one for our list.
So what happens when there's too much aldosterone?
Well, you said it regulates blood pressure, so I'm guessing high blood pressure.
Exactly. Hypertension is a common symptom.
That makes sense. Too much aldosterone, blood pressure goes up.
Right. And remember, aldosterone also affects potassium.
Right, you mentioned electrolyte balance.
Yeah, so too much aldosterone can cause the kidneys to get rid of too much potassium.
Leading to low potassium levels.
Exactly, which we call hypokalemia.
And that's not good, right?
No, not at all.
Yeah.
Hypokalemia can cause a whole bunch of problems, from muscle weakness and fatigue to constipation and even heart rhythm issues.
Okay, so we've got Cushing's with its physical changes and metabolic effects, and then Conn syndrome with blood pressure and potassium problems.
It's like these hormone-secreting tumors can really throw a wrench in the works.
They really can, and those aren't the only hormones, right?
Oh, you're right. Adrenal tumors can also secrete androgens, the male sex hormones.
Right.
This can lead to virilization in women.
Virilization, we talked about that before, right?
Yeah, it's where women start developing male characteristics.
So things like excess hair growth, deeper voice, that kind of thing.
Exactly. And in some cases, though it's rare, adrenal tumors can even produce estrogens.
Estrogens, those are the female sex hormones, right?
Right, and that can lead to feminization in men.
Wow, the range of possibilities is pretty wild.
It really is. But with all these different hormones, how do doctors know which one is causing the problems?
Yeah, it seems like it would be hard to figure out.
It can be a bit of a puzzle, but we have tools to help us.
Like what?
Blood and urine tests can measure the levels of different hormones.
So you can see which ones are out of balance.
Exactly. It's like getting a hormonal fingerprint.
I like that analogy.
And once we know which hormone is the culprit, we can tailor the treatment accordingly.
That makes sense. But is there ever a situation where these tumors are actually beneficial? Or are they always bad news?
That's a great question. It's true that most adrenal tumors cause problems.
Hmm.
But there are rare cases where they might be neutral or even beneficial.
Really?
Yeah, for example, some tumors might produce hormones that actually counteract other hormonal imbalances in the body.
So it's like they're balancing things out.
Right, like a built-in backup system.
That's interesting.
But even if a tumor is producing a helpful hormone, it's still an abnormal growth that needs to be monitored.
Because it could always change.
Exactly. What starts as beneficial could become a problem later on.
So vigilance is key,
Yeah.
even with a good tumor.
Absolutely. I think the main takeaway is that adrenal tumors are complex.
Yeah,
And their effects can vary a lot.
definitely.
That's why a thorough evaluation is so important.
So you get the full picture.
Right, including medical history, physical exam, blood tests, imaging, and maybe even a biopsy in some cases.
Well, I think we've covered a lot in this part of our deep dive.
We have.
We've explored the different hormone-secreting tumors, how they affect the body, and the tools doctors use to diagnose them.
We've come a long way.
But there's still one big piece left.
Treatment.
That's right. Join us for the final part of our deep dive,
Okay.
where we'll explore the different approaches to managing these tumors, from surgery to medication to those cutting-edge therapies we mentioned before. Cutting-edge therapies. I can't wait. See you back here soon for the grand finale. Okay, Deep Dive crew, we're back for the final part of our adrenal tumor exploration.
The grand finale.
Exactly. We've covered the different types, how they're diagnosed,
Right.
and all the hormonal chaos they can cause.
It's a lot.
It is. So now the big question, how do you actually treat these things?
Treatment, yeah.
I'm especially curious about those cutting-edge therapies you mentioned earlier.
Of course, but before we get to the futuristic stuff,
Okay.
we have to start with the foundation of adrenal tumor treatment, surgery.
Okay. Makes sense. Seems pretty straightforward.
It is.
Just go in and take out the problem, right?
Exactly. For many adrenal tumors, surgery is the first line of defense.
Okay.
The goal is to remove the entire tumor,
Right.
which often means removing the whole adrenal gland where it's located.
So basically an adrenalectomy.
Yeah.
But wait, don't we need both adrenal glands?
That's a common concern, but the good news is
Not that?
most people can function perfectly fine with just one. The remaining gland usually picks up the slack and produces enough hormones to keep everything balanced.
That's good to know. But what about cases where surgery isn't an option?
Yeah.
Like if the tumor's too big or a spread?
Right. That's when things get trickier, and we have to consider other options.
Like what?
If surgery isn't feasible, doctors might recommend radiation therapy or chemotherapy.
The heavy hitters.
Yep.
How do those work for adrenal tumors?
Well, radiation uses high-energy rays to target and destroy cancer cells.
Okay.
It can be used to shrink a tumor before surgery,
Hmm.
to clean up any remaining cancer cells after surgery,
I see.
or to help manage symptoms if a cure isn't possible.
So it's a pretty versatile tool.
Exactly. And then there's chemotherapy
Right.
that uses powerful drugs to kill cancer cells.
Hmm.
They can be given intravenously or taken orally, and they work by stopping those cancer cells from growing and dividing.
Okay, so we've got the classics.
Yeah.
Surgery, radiation, chemo. But now I'm really curious about those cutting-edge therapies.
All right, let's dive into those.
Yeah.
One exciting area is targeted therapy.
Targeted therapy.
Yeah, these treatments are designed to zero in on specific molecules or pathways that are essential for cancer growth, but they leave healthy cells pretty much unharmed.
So it's like a precision strike.
Exactly. Minimal collateral damage.
That's incredible. What kinds of targeted therapies are being used for adrenal tumors?
Well, one example is mitotane.
Mitotane.
Yeah, it's a drug specifically used for adrenocortical carcinoma.
Okay.
And it works by disrupting the production of those steroid hormones.
So it's like cutting off their fuel supply.
Precisely. And researchers are also investigating drugs that block specific signaling pathways involved in tumor growth.
Like those pathways we talked about earlier.
Exactly. Pathways like the mTOR pathway and the IGF-1R pathway.
Right, where the tumor cells are hitting the gas pedal on growth.
Yep. And by blocking those pathways, these targeted therapies aim to slow down or even stop that growth.
It's amazing. So it seems like the future of adrenal tumor treatment is all about personalized and targeted approaches.
It really is. Less damage, more precision.
And you also mentioned immunotherapy, right?
Oh, yes. Immunotherapy is another incredibly promising area.
That's been a game changer in so many areas of cancer treatment.
It has.
So how does it work?
Well, our immune systems are incredibly powerful, always on the lookout for threats.
Right.
But sometimes cancer cells manage to sneak past. Immunotherapy basically gives the immune system a boost,
Okay.
helps it recognize and attack those cancer cells more effectively.
So it's like giving our natural defenses a power-up.
A perfect analogy. Some immunotherapies block the signals that cancer cells use to hide from the immune system.
So they can't stay hidden anymore.
Right. And others actually involve engineering immune cells in the lab to specifically target and destroy those cancer cells.
That's incredible. It sounds like there's so much hope on the horizon.
There really is.
But for someone newly diagnosed with an adrenal tumor, it can still be overwhelming. What advice would you give them?
Well, first of all, don't panic. It's normal to feel a lot of emotions. But remember, knowledge is power. Take the time to learn about your diagnosis and the treatment options.
So do your research.
Exactly. Ask your doctor all the questions you have.
Okay.
Don't be afraid to get a second opinion if you need it.
Right. It's your health.
Your healthcare team is there to help you through this.
And find a doctor you trust.
Yes, someone you feel comfortable with.
That's so important. And remember, you're not alone.
Right.
There are support groups, online communities, so many resources out there.
Absolutely. Connecting with others can make a huge difference.
And last but not least, hold on to hope.
Yes, hope is essential.
The field of adrenal tumor treatment is constantly advancing, and the outlook for many patients is really positive.
We're learning more every day, and those cutting-edge therapies are becoming more effective all the time.
That's a great note to end on. Well, everyone, we've reached the end of our deep dive into adrenal tumors.
It's been a journey.
It has. We've gone from the basics of diagnosis all the way to the latest treatments.
A lot of information packed in there.
I hope you feel more informed and empowered.
Yeah, knowledge is power.
Exactly. Thank you for joining us on this adventure.
It's been a pleasure.
We'll be back soon with another fascinating topic, ready to unearth more knowledge and share it with you. Until then, stay curious, keep exploring, and remember, knowledge is power.